Hello, everyone. I'm Mayor Michael Hancock. Thank you for taking the time to join us for this very important conversation about the COVID vaccine as we work to move from rescue to
Hello,
recovery
đây là
in Denver.
Mayor
Before we get
Hancock
started,
và
I
mình
want to
nói
let
chuyện
you know
về
that we have real-time
COVID-19.
translation available in Burmese, Vietnamese,
Và
Korean,
trước
and Mandarin.
khi mà nói
You
thì
can access
có
it by clicking on
những
the
cái này
globe
thì
at the
có
bottom right corner of your screen that says interpretation and select the language. Now, we know this virus has disproportionately impacted communities of color, not only in Colorado, but also across the country. That is why we are doubling our efforts to ensure that every person who wants the vaccine has access to the vaccine and understands that it is safe. This evening, we are going to focus on our Asian American and Pacific Islander communities. Building trust and ensuring safety for our neighbors is even more critical given the misinformation spread early on this pandemic more than a year ago. It's no coincidence that amid racist rhetoric that we saw a spike in bias-motivated crimes against Asian Americans in our city. For the first time in 5 years, there were 3 reports of bias-motivated crimes against Asian Americans in Denver, 3 separate reports. And the police chief tells me many more were unreported. I want to say it very clearly tonight. We will not tolerate that in Denver, Colorado. I also want to recognize 2 members of my leadership team who hold key roles in my administration, have been with me for 12 years, or 10 years as mayor of Denver, Colorado. First, I want to acknowledge Derek Okubo, Executive Director for the Agency of Human Rights and Community Partnerships, and Eric Haraga. He's Executive Director of DEDO, our Office of Economic Development and Opportunity. I want to thank both of them for their service to our city and for supporting tonight's event. We're going to get started in just a moment. This is going to be a wonderful, wonderful conversation. It is my privilege tonight to introduce our panel. This is a group of incredibly talented, accomplished members of our community. And together, we're going to have an honest conversation to give you the facts about the vaccine and hopefully ease any doubts you have about getting it. Let me introduce our panelists. First, I'm proud to introduce Harry Budi Sahara. He is Executive Director of the Asian Pacific Development Center. Harry works with government officials and community partners to address health disparities in refugee and immigrant communities and has extensive experience in nonprofit and government relations. We're also glad to be joined by Dr. Anuj Mehta. Dr. Mehta is a pulmonary and critical care physician at Denver Health, who also has appointments at National Jewish Health and the University of Colorado Anschutz School of Medicine. He chairs the Governor's Medical Advisory Group on vaccine allocations, among other critical COVID advisory roles during this critical pandemic. And we're very happy to have Layla Ireland. Layla is not only a COVID survivor, she is also a retired combat medic. Thank you for your service, Layla, and served for 12 years in the United States Army. Layla and her husband came out as transgender service members and shared their story in a New York Times short film that earned an Emmy nomination and was celebrated nationally for their courage and advocacy for changing the policies that ban their service. She works at Fort Carson and continues to advocate for the LGBTQ community. Thank you all for being here tonight for this very, very important conversation. Harry, I want to start with you. Give us a historical context for how the AAPI community has responded to the pandemic.
Sure thing, and thank you, Mayor Hancock, for having us here. I am privileged to be the executive director of a local community organization that does a lot of work directly with the community, both immigrants, refugees, and people that are born in the US. And we definitely have seen a wide variety of responses from our community regarding the vaccines. There are a lot of fear and distrust for a variety of reasons. Not surprisingly, the US government does have a long history of, intentionally harming communities of color, including the Asian American communities. So for example, I think one of the most famous case is the Tuskegee study, where the government intentionally infected the African American communities with syphilis without telling them. And and I don't think a lot of people realize that during World War II, the U.S. military also experimented on African American, Japanese American, and Puerto Rican soldiers by intentionally exposing them to mustard gas and other chemical agents just to see how they will, be affected by those chemical agents and mustard gas. So, in light of all of these history, we definitely have seen some hesitancy in our community regarding the safety of the vaccine. Can I trust the government? How fast, this vaccine was developed in less than a year. Is it truly safe? And I'm glad that, Dr. Anuj Mehta is here to kind of talk about those technical details regarding why the vaccine is safe.
Journalism, I forgot you got to mute yourself and then come right back. Harry, thank you for that, and a great segue to Dr. Anuj Mehta. Dr. Mehta, come on up. We celebrate, of course, the scientific and medical communities for working with lightning speed to develop a vaccine and get it to the market in record time and warp speed. It was fortunately the action, but unfortunately the name, which lends itself to even greater concern about whether or not this vaccine is safe and if certain corners were cut, whether or not we followed all the protocols. Let's dispel that tonight for the community. Is this vaccine safe, and were all the protocols followed and the trials duly handled by the scientific and medical community to bring the vaccine to the market?
The answer is yes, the vaccines are safe and they're highly effective. I want to thank Mayor Hancock for inviting me. I want to thank my co-panelists and really start off by thanking all of the frontline workers that have been working so hard. I've had the privilege, I'm an ICU doctor. I've been working in the intensive care unit at Denver Health for a very long time with the pandemic, and everybody that's been pitching in, that's how we're getting through this together. With regards to the vaccines, I think the name Operation Warp Speed, while it sounds fun because I'm a sci-fi nerd, it was really a misnomer. The technology for the vaccines has been being developed for decades. We've been working on the RNA technology for a long time, and we not waiting, but it's been this moment that it's allowed us to take that final leap into effective vaccines. All of the scientific trials followed the standard protocols for any vaccine that we've developed in the last 20 or 30 years. In fact, the great deal of media scrutiny meant that they had to take extra efforts to ensure that the trials followed the standard protocols. And one of the most amazing things as a scientist is that the data has been exceedingly publicly available. Anyone on this call can access the full data from the Pfizer and the Moderna trials, 55 pages released by the FDA to review the safety and efficacy. And I think that openness, that transparency really shows us that the standard protocols building on decades of past work really has got us over the milestone in developing this vaccine in a very fast timeline, but an appropriate timeline for the need. And I think it's important to remember that really this was an effort where every single pharmaceutical company essentially laser focused on this. And that's the other thing that allowed us to do this faster. It's not that we took shortcuts, it's that everybody was working together, much like how all of the healthcare workers, all of our government officials have been working together to get us through this pandemic. So they're safe, and these are home run vaccines from an efficacy standpoint.
Dr. Mehta, I'm gonna stay with you for just a moment because I think you said something that piqued my interest. First, we conclude the vaccine is safe. Secondly, it followed all of the standard protocols, although in warp speed, we stepped it up. People were dying, right? 500,000 people died worldwide from this virus, but 500,000 people died. People were dying here in the United States. We needed to get this vaccine. I told you I would do that. This vaccine to the market as quickly as possible, begin to start saving lives. But you said something we've not heard. This is the 5th panel we've held on this issue in various communities, and no one has said the technology used as the foundation for the vaccine has been in the works for years. Can I ask you to expound on that?
Sure. So basic biology, DNA, and RNA are things that scientists have been studying since they were first discovered in the 1950s. And the ability to look at the sequence or the instructions for a virus is something we've been building for about 20 years. It's something that was really developed out of that Human Genome Project for anyone that was around when that happened 20 years ago. And so we've been able to read the RNA of viruses and bacteria, and we're able to actually make these segments in a lab very safely for research purposes. And importantly, the RNA technology that's unique to the COVID vaccines has actually been tried for other diseases like cancer. Several years ago, a decade ago, they didn't work at curing cancer, at least the technology, and now it's been adapted to vaccines. So we've seen many years of safety as we've tried to get the technology to work. But this is the time where vaccines are really where it's come to light, where we found something that is both safe and highly efficacious. There is literally almost no other vaccine that has 95% efficacy with this type of safety profile. And I will say that I have received both doses of the Pfizer vaccine. My wife is a healthcare worker. She's received both doses. My father, who was born in India, so he's an immigrant. I was born in the US, I'm first generation. He's received both doses. And I know a lot of people have questions, and questions are okay. And this is the time to try and get the right information as opposed to the disinformation that's out there.
And that's why you're here. This is phenomenal information for all of us. And one last thing with regards to the trials, tens of thousands of people were involved in the trials of both of these vaccines, as well as the Johnson & Johnson vaccine that is being on track to come to the market shortly. Pretty diverse populations of people were involved in these trials. Can you talk about that?
So I think that it's important to recognize that some trials that, for a heart disease medication, for a blood pressure medication, they may have 1,000 people, 2,000 people. The COVID vaccine trials, the Pfizer trial had over 40,000 people in it, and the Moderna trial had over 30,000. So these were huge trials to try and make sure that it's efficacious and safe across broad populations. I think Harry really talked about histories of distrust. And there has been a long history of distrust in research amongst communities of color. And we've seen that people have not wanted to participate in these types of trials. There was an active effort, what I think is a new stepping stone in medical research, to recruit volunteers from communities of color that have traditionally not been actively engaged in research. And this was a time where communities of color stood up and said, I want to take part in ending this pandemic. They took ownership and they participated in these trials in record numbers, to the point that both the Pfizer and the Moderna trial were truly diverse, and they looked like us. They look like the population of people that live in Denver, that live in Colorado, that live in the United States. And while nothing is perfect, this is the best I've ever seen in medical science. And I have spent the last, I don't want to say how long in terms of medicine, that I've been reading clinical trials. And this has been truly remarkable, the diversity that I've seen, and gives me a lot of confidence, not only in recommending the vaccine for myself and my wife, for my dad, for my family, and for my patients.
Yeah, that's pretty powerful. Thank you, Dr. Mehta. That's pretty powerful. We're going to come back to you. I'm going to bring up Layla Ireland up here. And Layla, I want to thank you for being a part of this panel discussion. There's a lot we can thank you for. One, for your service to our nation as a member of the United States Armed Services, but also for your courage of stepping up and stepping out and demonstrating that you can serve this country even as a gay transgender. And I want to thank you for that. But today, you're also here to talk about the fact you're a COVID survivor. Can you tell us a little bit about your experience having gone through contracting the virus?
Yes, absolutely. Thank you so much, Mayor, for having me on this esteemed panel. The conversation is super important. When COVID came out, it started hitting the US really hard back almost a year ago now. Nobody really kind of took it seriously. And as a young person, working in the medical field, yes, I saw it as a thing that was coming, and I felt like, you know, it was another thing like the flu, but I really didn't understand the severity of this virus. And so I went on a work trip, came back, and I immediately got sick quickly. I have no, you know, pre-existing conditions. I had none, and when I went to the ER, they tested me, and here I was, sick with COVID, and it got so bad very quickly. And I ended up spending about 4.5 to 5 weeks out of work because the symptoms just got worse over time. And that last week when it did start to get better, I really was very grateful for the fact that, okay, I'm going through this, and I was understanding what people were talking about, listening to the news, listening to, you know, my work basically saying this is what's happening. And so being a survivor of COVID, sure, it's a great thing to say, right? Because there are a lot of other people out there that have not had that opportunity, or very they were afforded that opportunity to survive COVID. There are tons of families across America that have lost family members and friends and loved ones to this very serious virus. And so, you know, I've received both doses of Moderna. And I am happy to report that I'm doing perfectly well. I have all 10 fingers and 10 toes. I'm perfectly fine. And I think one of the biggest misconceptions about getting these vaccines is that, you know, the physical reactions that you might have. Sure, just like any other vaccine that you get, you will have some type of reaction, but it's not as severe as people are thinking it's going to be. Part of that is, I think what people are fearing is that one of the things that I heard was that this virus came from China. And so that let's break that myth. We don't even know if the virus came from China. Regardless of where it came from, it is a non-discriminant virus. It transcends any community out there. No community is safe. You know, Harry mentioned that since COVID-19, anti-Asian crimes have increased, but I don't think people really understand how much they've increased by. It increased by 1,900% in the United States. There have been nearly over 3,000 reports of anti-Asian incidents that are reported in over 47 states over this last year due to COVID. That's a phenomenal number, and to even think in my own community that our people are being targeted because we're Asian American or Pacific Islander. Working in the medical field, I've heard, you know, whispers in the hallways that, you know, Asian people are carriers, and that's not true. I know of folks who were asymptomatic that were carriers, and they're not Asian. So what does that mean? We have to break those myths, right? The pandemic has quickly fostered and continues to unleash a tsunami of hate crimes and microaggressions that have instigated xenophobic behavior, scapegoating, and scaremongering. You know, Dr. Mehta mentioned distrust in the community for the vaccine and faith in getting the vaccines done. But as a community, it is very important to encourage our own folks now to strengthen the immunity of our societies against not just the coronavirus itself, but the virus of hate, because we're going to be absolutely stronger together. And when we step out as Asian American Pacific Islanders and we get the vaccine and we show people that we're not afraid to get this done, we are showing them that it is not our fault. And that, you know, this is going to make our community safer.
Thank you for going there in terms of the bias motivated crimes. And I'm going to open this up to the entire panel because I want us to hit this head on. Following 9/11, we saw bias motivated crimes directed toward Muslims and people from Middle East or Middle Eastern looking individuals. Of course, we had, unfortunately, leaders in Washington, in the White House, who called it the Asian virus, the China virus, and people grabbed a hold on that. And to your point, we have seen an increase in bias motivated crime toward Asians. These are some of the most dastardly inappropriate actions, and it's ignorant. It's very ignorant, but it's rendering a community in fear. Maybe people so fearful they won't go out, they won't live their lives as they normally would. They won't seek the virus or even seek testing in that case. It gripes me, and I'll never forget early on during the onset of the pandemic here in Denver, and we were in our emergency operations center almost a year ago. And I got word that there were bias motivated crimes toward the Asian community increasing in Denver because of this, the language, the verbiage that was being used in Washington. So let's talk about it for a moment. First of all, how does it make members of our Asian community feel? And two, what can we as a community do to, properly protect and move into bring compassion to our Asian and Pacific Islander neighbors? Anyone?
And Mayor Hancock, I can jump in just for a moment on that one. I mean, hate crimes, it has a long history in our community. I mean, this is not something new that just came here because of COVID or because of President Trump. I mean, if we go all the way back to the 1980 settlement of Vietnamese refugees, and you look at the newspaper headline, the op-ed pages from those times, nobody was saying, oh yes, let's welcome these refugees. The headlines are eerily similar to the headlines we see nowadays when we talk about refugees from other countries, right? We should not accept these Vietnamese people because they could be double agents of the Viet Congs. Just like you see headlines saying we should not accept refugees from Syria because they might be double agent of ISIS. We see this rearing its ugly head from time to time. It definitely has been exacerbated by the action of the Trump administration official for the past 4 years, starting with the xenophobic rhetoric early on, saying the Muslim ban, these are bad refugees, bad immigrants, they cannot come in, all the way up to the whole public charts threatening immigrants, saying that if you seek health care, we will use that as a reason to deport you. Mm-hmm. And then also the threat regarding the US Census, such as, the effort to say, if you are not a US citizen, we do not want to count you. That has a particular ugly callback to how the US government used the census data to round up Japanese Americans during World War II for internment. So I think, we have to recognize that the hate crimes is not just an isolated act of ignorant individuals attacking our community. It's heavily supported and encouraged by actions by officials. So one of the first steps we need to do is definitely officials at all levels of government need to take a firm stance and statement condemning these. And I do applaud you, Mayor Hancock, because you were one of the mayors that issued statements strongly condemning the hate crimes against Asian American community a few months ago.
Yeah, I appreciate that. We were just caught off guard and completely pained by what we were hearing. Layla, Dr. Mehta, any thoughts on this issue of bias motivated crime, hate crimes?
Yeah, yes, Mayor, I do. I think it's important that we, as a community, we have to end the model minority myth. We have to educate ourselves on the wide Asian American experience, because it's a vast and vital part of the tapestry that makes up this country, right? And also volunteer or donate to your time to organizations like that cater to the Asian American Pacific Islander community. We learn more when we open ourselves up to other people and other organizations outside of our own norms, right? But we also have to support our own community. Many, if not most, have lost their businesses at the start of COVID-19, and a lot of them have not recovered yet. So supporting our communities and doing that, we garner the support from outside folks as well. We have to amplify all the people in our community, in whatever facet they are, artists, authors, activists, whatever. We're sharing their stories and their work to give them a bigger platform, and so that everyone can see that we're just like everyone else in their own communities, that we're no different. Yes, we may be unique in the way that we present or the way that we look, but we're all still part of one big one big family, if I may. And then also on the hate crimes portion of it, speak up. Silence is violence. It really is. And so I think it's important to make sure that our folks see that and put themselves in those shoes, in the person that's receiving the violence, in their shoes. I think if we are able to really relate to them and show them that if we were in that position, we would want someone to speak up for us as well. So they should do the same, because using your voice and influence does stop hate. It does stop violence, but we have to stand together.
I would say.
Go ahead, Dr. Mehta.
So I was in New York for 9/11, and I remember afterwards running in the parks there and getting spit at. So I can say that that wave that Mayor Hancock you referred to, I know what that's like. So what I can tell people is that the vaccine is an opportunity to take ownership. Get vaccinated and show people. Put the picture of you getting the shot on social media. Show people that the Asian American Pacific Islander community is not the cause, they're part of the solution. And getting vaccinated is part of that. And I want to follow up on something that I think just from a science perspective is really important that Layla mentioned about some of the side effects with the vaccine. Yes, you may have a fever, you may feel weak, you may feel tired, especially after the second shot. You cannot get COVID from the vaccine. Some of the side effects are similar, but the vaccine activates your immune system. And I know there's a lot of disinformation that people think they're going to get COVID from the vaccine. There is no COVID virus in the vaccine. You cannot get COVID from the vaccine.
Thank you for dispelling that myth. You're always a step ahead of me, Dr. Mehta. I'm enjoying your engagement on this because you're so thorough about this. Let me ask you to address the issue of variants. Obviously, we're hearing every day from the UK, from South Africa, from Norway, variants that are being discovered all over the world. And here in the US, they're here. And people may say, listen, why take it? The reality is the variants are here. We're going, you can take the shot and still get the virus. Let's talk about that a little bit.
Yeah, so it's a legitimate concern. And this is where science needs to catch up. And I think we've been doing that of late. And there's been a lot of reports about how the vaccine works with some of the variants that we've seen. Let me also assure people that viruses mutate. This is not something unique to COVID. This is something that we've anticipated for a long time. Actually, the way to prevent it is to slow the spread of the disease by wearing a mask, washing your hands, and staying 6 feet apart. All the hard public health things, I want to go see people, but even now after vaccinated, I'm still not. That's actually how we can prevent new variants from forming. The ones that we know of, the ones that have been most in the media, the UK, the Brazil, and the South Africa. We have some early data that the vaccines are just as efficacious against the UK variant. And that's very reassuring. That's the one that was first found in Colorado. And that's the one that's probably the most widespread in the United States. There does appear to be maybe a little bit of a drop off in efficacy with the South African variant. But remember, we're starting at 95% efficacy. And that is the home run of the vaccine. So if it drops to 80% or even 70%, that's still fantastic. The yearly flu vaccine that everyone should still be getting is anywhere from 40 to 60% efficacy every year. So the COVID vaccine, even if it drops off in efficacy against the South African variant, is still super effective. And we suspect that most importantly, the vaccine will prevent the severe forms of the illness, like ending up in the ICU, being my patient, ending up on a ventilator. You don't want that. You don't want to be my patient in the ICU. And so these vaccines are highly effective against what we have typically been seeing, and we think they continue to have a high efficacy against the variants.
But something tells me if I'm going to be a pulmonary patient, I'm coming to find you, Dr. Mehta. That's where I'm going. So let's talk about it to the entire panel. We have now, we're at phase 1B2, 60 years or older are eligible to take the test. Of course, anyone with underlying conditions, healthcare, professionals, teachers are in now. What are you hearing out there? Are you hearing people, willing to take it? What's your sense?
Working in the medical field, Mayor, I don't think people are afraid to take it. They just want data that shows that it's working. So a lot of the consensus is that they're just waiting to see what it looks like, the side effects, and what the response to it is. And obviously, as a
So,
leader,
let me come in, Layla, real quick, because I'm glad you said it. I had this conversation with someone very, very close to me, and they liken it to technology coming onto the market. Like, I'm not going to be the first one to buy the iPhone. I'm like, this is not an iPhone. This is not technology. This will kill you. Okay, understand me. And you can get it from folks who don't look sick, right? So I got to ask you to go. I would need you to talk about that for a minute. This is not be the second phase kind of. I'll be next. I'll wait until
Correct.
90 people have it and see how they
yeah,
react.
you know, like I said, as a leader, we have to step forward, right? We have to be the example that we want to see in our communities. And so I wanted to show folks, look, I'm just as scared as you all. I'm just as skeptical as you all, but at least I know that I'm taking some type of precaution and taking the initiative to be the person that's going to step forward and say, okay, hey, look, I'm doing this. And once you see me take the second shot, then maybe you might want to rethink it, because this is going to be important, not just for the people around us, but for your own life. And so you're right. Talking, in comparison to an iPhone, it is not technology. This is your life that we're talking about. And if you really want to be around to see your loved ones thrive, to see them tomorrow, to see them in a month from now, or whenever we decide to open up the outside fully, it's important to really take that initiative, suck it up, Buttercup, and move forward with this shot on vaccine, because it's important. It not just for yourself, not just for your family, but for society altogether.
Harry, are older Asians and Pacific Islanders willing and ready and lining up to take this virus? Or keep saying that, vaccination?
And I want to echo what Layla just excellently put. I mean, we were fortunate that we were actually able to host a vaccination clinic yesterday. And we specifically recruited a lot of our elderly population. And yes, what we have noticed is we haven't met anybody that is like a hard no, absolutely, I will not take this vaccine whatsoever. It's been a lot of soft yes or soft no, right? Where it's like, I'm somewhat opposed, mostly because I'm a little nervous, I'm a little bit scared. And it is a common sentiment among the elderly populations that we serve. So the way to counteract that is that we specifically recruited trusted community leaders to come to the clinic, to be recorded by video and photo of them taking the shots along with their friends and their community members. And what we have seen is that once the community see their trusted leader taking the vaccines, they're a lot more willing to do it. So it's going to be a lot of very personal one-on-one reaching to the community. I don't think we can just rely on celebrities to do it for them. I think we have to go down deep into the local level. But I think it's definitely doable.
And specifically to address people that said they want to wait to make sure that it's safe, let me reassure everybody, 58 million people have received a dose in the United States, right? How many more people need to get a dose for you to feel that it's safe? I mean, that's a huge number.
And I love that. And that's a good test for technology. If you got 58 million people using an iPhone, it works, right? I love to do this round with panelists, and we've done it now. And 5 of the panels we've had, where we do kind of let's bust a myth tonight. And I'll start with you, Dr. Mehta. You've given us several myths. One, it's safe. Well, one myth was it's unsafe. You clearly demonstrated that it is safe. What other myth is out there that you love to bust tonight?
The biggest one that I think is out there is the fear that you can get COVID from the vaccine that I spoke about earlier. And I understand the side effects of the vaccine are fever, chills, weakness, and fatigue. That sounds like COVID. If you have those and you haven't been vaccinated, you should probably go get tested and make sure that you don't have it. But that's actually a sign of your immune system being activated. There is no coronavirus in the vaccine. It is impossible to get COVID from the vaccine. And that's the #1 myth that I think I see with the coronavirus vaccine, but also the flu vaccine, which is something I advise all my patients to get every year, and then I get as well. And the biggest reason people tell me they don't want to get the flu vaccine is because they think they're going to get the flu from it. And I think that same myth has been perpetrated, that disinformation, that misinformation has been perpetrated with the COVID vaccine. And for both flu and for COVID, it is impossible to get the coronavirus from the COVID vaccine.
All right, Leila, bust the myth.
You know, in the beginning when COVID hit, Mayor, everyone was saying that, you know, if I'm really healthy, if I stay fit, that I'm not going to get COVID. And that, I mean, we've seen across social media on news platforms, these large number of groups of young folks who, you know, party together, have turned out to test positive, for lack of better phrases, right? So we, you know, young people are discriminated against when it comes to catching, you know, being diagnosed with COVID-19. It is important to follow the safety precautions, wearing masks, keeping 6 feet apart, not gathering in more than however many people you're not supposed to. Obviously, within reason, if you are in a household, it is, you know, there's different restrictions, but young people are not, they are not immune. Even if you are very healthy, I'm a very healthy young person myself, and I got COVID-19 just by traveling. Yeah. So let my story be a highlight for you and a reality that just because you work out and you take care of yourself and you're young, that does not mean you are immune to it.
And unfortunately, we have lost young people. We've lost children to COVID. So I appreciate you going there, Leila. Harry, you're going to bust a myth for us?
Yes, I think the myth that affects a lot of the immigrants and refugee community is the fear whether, you know, if I take this vaccine, is ICE gonna use it to deport me? Is this gonna be used against my green card citizenship application? And that's an absolute myth. It will not be used against you in immigration proceeding. ICE is not gonna be there to deport you. And Department of Homeland Security issued a statement a few weeks ago reaffirming their stance that they will not be conducting any kind of investigation in anywhere near healthcare facilities or vaccination clinic. I did a check before before this roundtable, and I am pretty sure there has not been a single case of any immigration authorities coming anywhere near vaccination clinic throughout the country.
I appreciate that. Let me throw one out there. I'll bust a myth tonight. One is cost, that this vaccine will cost. It is free, folks. Our government set it up. They paid for these vaccines for all of us to be vaccinated. I'm excited that President Biden has committed 600 million doses of the vaccine by the end of July, which means there's enough for all of us to be vaccinated. But it is free of charge, and you don't have to worry about paying. We understand that some providers have said, we just want your insurance information. There is no need to provide any of that. There's no need for you to worry about paying for this vaccine. It is free. So to Harry's point, you do not have to be, if you are a resident of this nation, you can get the vaccine. To Dr. Mehta's point, they are not injecting you with the COVID virus in order to build your immunity. That's a myth that's out there. It's not occurring. And Leila, thank you for going there with regards to the age. You can catch this virus and you can lose your life from this virus. And this has been, I cannot tell you guys how wonderful you have been tonight in terms of talking about these issues. It has been just tremendously wonderful. And so I want to thank the panelists for this conversation. I want to thank so many people who made this panel possible. Our Denver 8 team, who is just the best in the world, so willing to work with us to get these sort of things done. To our Joint Information Center, that is part of our Emergency Operations Center, we want to thank you for making this panel possible and all of the panels that we've been able to conduct. I want to share some vaccine information with folks, especially if you're age 65 or older. Call the state hotline. We have it up right now, right there on the screen, excuse me. And that's 1-877-COVAXCO. Please call if you want to know. You can also sign up for COVID updates from the city and county of Denver. This is not a vaccine registration, but it will update you on events and information. We ask you to do what the panelists have already talked about. Get the vaccine. When your phases up and you are called, go to, talk to someone. If you don't have access to technology, let others help you get registered so you can get the vaccine. Call your doctor, call the pharmacy closest to you, go to the website, check out for updates on the city website. We want you to get vaccinated. We also ask you to continue to do the things necessary. Wear a mask when you're in public, social distance, and continue to wash your hands and help all of us stay safe. You, your families, me, your neighbors, your people you come in contact with, please help everyone stay safe. We're close to the finish line, and I believe that we'll turn the corner sometime this year. And if we keep doing our part, we'll keep everyone safe until we get there. We'll get from this phase of being rescued or going through a rescue to ultimately recovery. To Layla, Dr. Mehta, to Harry, thank you all very, very much. This has been an informative, wonderful, wonderful panel, and I've thoroughly enjoyed listening and engaging each and every one of you.
Thank
Have
you.
a great one. You bet. Thank you again. Take care, everyone.